I'm Eithne Treanor, and I'm going to be your moderator for this session. And this is the opening session of the day. On this stage, we have a lot going on right throughout the day, but we're going to kick it off to have a look at our sustainable future through data-driven healthcare. So it's something I think that impacts every one of us. Are we keeping well? Are we feeling well this morning? Are we getting enough sleep? Are we getting enough exercise? Will we live longer? Will we live longer better? All of that, we have lots of questions to look at. And of course, this brought to you by STC, so we're delighted they've come into this. Let me get them up on the stage, please. Business Development General Manager here for STC in Saudi Arabia, Saad Alrabiah. Come on, let's give him a welcome. There's not too many of us here, but we're going to make Saad feel welcome here, and we'll make him work well. From STC also, the Pre-Sales General Manager of Solutions by STC, Abdullah Al-Otaibi. Lovely to see you. We're delighted to have with us from Aura, the CEO, Tom Hale. Tom, great to see you. And from Ginkgo Bioworks in the US, the head of Epidemiology and Global Risk Analytics, Nita Madhav joins us. So Nita is with us. So thank you all so much for joining us. And, you know, as I say, we have a lot to talk about when it comes to, you know, healthcare and the new digital, new power, the new future of healthcare. And Saad, if I might start with you, when we look at healthcare particularly, big focus here in KSA. I think if we were to come here maybe 10 years ago, the healthcare environment was probably very different. So can you, I suppose, tell us like what has changed in healthcare in this region? And why STC? You know, you were a telecom company and now you're ITC, and you know, but now you're in healthcare. There you go.
Well, first of all, good morning, everyone, and thank you, Eithne, and privileged to be part of this esteemed panelist setup. True. So, as part of any developing country, maybe the common factor is an always developing mindset. So 10 years ago, as you brought up, healthcare was there, physicians was there, the ecosystem was there, but the effectiveness maybe could have been, and definitely with time we proved, it could have been better. Clinical outcomes are improving, accuracy in medical diagnosis are improving, and technologies are improving even faster. And so where we're standing on is on a developmental momentum, but also at the cusp of something even more transformative as we move into the future. And I think STC, and we will shed more light on that as we go forward, can help a lot in transforming the sector.
Okay. Now, Abdullah, your department is Solutions by STC. And when we think of, I think, any industry at the moment, and it doesn't matter if it's healthcare, if it's energy, whatever it is, we all need new solutions. So talk to me a little bit about what this actually means when it comes to healthcare.
So if we look at every sectors, usually they have their own challenges and their own priorities, and healthcare stands distinct from the perspective that it has direct impact on human lives and well-being. If we see and witness the recent pandemic and the crisis that happened a few years ago, has proven that digital and data infrastructure play a very strong and major role in enabling healthcare organizations to, in their day-to-day operation, as well as in making sure they provide an optimized care services to the patients. What we have witnessed as well, that the move that healthcare organizations today are taking when it comes to being more patient-centric, putting the patient at the center of everything they do. And this is driven by the increasing availability and accessibility of data, which allowing now healthcare organizations to provide more personalized healthcare services, as well as the expectation that usually patients today have when it comes to healthcare services. They are much more today more informed, knowledgeable, and they expect more from healthcare providers. Lastly, I think one of the dynamics that we have witnessed that around the regulatory landscape, not only within the healthcare sector, but as well as from the digital and the data privacy sector as well, where healthcare organizations navigating all of these challenges to make sure that they are in compliance and they are, as they are adopting new innovative services around telemedicine or integrating their own legacy systems with the patients or with other organizations to take the full potential of data and AI capabilities. These are the top dynamics that we have witnessed in the past, and I think this will continue to be accelerating as well moving forward.
Yeah, I mean, there's a lot going on, a very dynamic sector at the moment. Now, I'm sure many of you have wearables. I've only got my watch here, but Tom here has a few rings. He's looking very trendy here with his platinum and brushed steel and fancy rings. He's going to tell us a little bit about that. But Tom, when we think about, and just what Abdullah was saying there, you know, the patient is sort of more in control, the patient is more informed, you know, but talk to me about what you would see the biggest changes. And are we really looking at healthcare now that we have to move from prevention or from intervention to just prevention? I mean, there's a lot we can do ourselves. Tell us about that.
Yeah, if you look at the negative outcomes, maybe 20% of negative outcomes might be genetic in nature. Maybe 20% might be exposure or environmental in nature, a pathogen or something you get from your environment. Maybe 60% are behavioral related. And so the impact of that is that if we really want to change the outcomes, you have to change behaviors. Changing behaviors is hard. Prevention is hard. It actually requires the patient to do something. Yes, the patient's at the center of the experience, but they have to actually want to change. And you have to educate them, and you have to give them the data and information to change. So I think data is key for helping provide better care, maybe personalized care. But I would argue that you would start from a point of prevention. And in order to provide best prevention, you want to give people the information, the knowledge, the understanding, and the data for them to see changes in their behavior reflected in their biometrics. And those changes in behavior are the long-term effects for the biggest adverse health outcomes: heart attack, type 2 diabetes, cognitive illness like Alzheimer's and Parkinson's. If you can actually make behavioral change and sustain that over time, you can change the outcomes much more than you can change by improving survival rates of an intervention from an illness.
And again, that's going to, as you say, that very different outcome will clearly change the industry down the road. I mean, it might take a little while, but we'll talk a little bit more of that. Now, Nita, when we look at, and I think one thing everybody, felt was the fallout from the pandemic. You know, none of us missed that one. But when we think maybe about the lessons that we learned there, you know, how do you monitor disease trends, I suppose, and really conduct surveillance that can, you know, prevent breakouts? Ultimately, we don't want it to happen again. You know, I don't particularly want it to happen again, but you know, in terms of how does that work, what are the regulations around it? You do something very specific at Ginkgo Bioworks. So talk to us a little bit about that sense.
Yeah, so the traditional surveillance model for infectious diseases to find out when there might be a pandemic or epidemic in its very early stages centers a lot around reporting from healthcare facilities, from doctors' offices and clinics. But what we want to do is get earlier in that process because as we've seen many times, early detection of a nascent pandemic or epidemic is key to being able to stop it in its tracks and prevent a loss of life and economics damage. So what we do at Ginkgo Bioworks is we are trying to augment data from traditional sources with non-traditional sources. We're looking at media reports, we're looking at unofficial data coming in from different feeds using AI, natural language processing, to get those early signals and figure out what might be happening. We're also doing environmental-based monitoring of wastewater and passenger swabbing voluntarily in airports to understand what pathogens or disease-causing organisms that they might be carrying. And through these methods, we are finding that we can get earlier detection than what could be found in a clinical setting. And I'm especially excited by the prospect of being able to tap into some of the data sources of continuous monitoring that we might be able to find with wearables as well.
Yeah, it does. It's making a big difference. Saad, come back to this issue of, the customer, well, the patient, the customer. We hopefully don't want to be patients. We're healthy people at this point. But we need to be more involved in that decision making. And again, what difference is that making to the business model, I suppose?
And so it's such a great question. The health operators and regulators are getting more creative in how they want to unpack and sustain services, financially sustain them. And so there are models of business where the cost of implementing these technologies can be lowered in the beginning. So basically, it becomes on installments or based on usage or based on data storage. All those kind of open-ended models of pushing the agenda forward in terms of digitizing healthcare. And I think that's part of what we try to do as a large corporation. I'm going to kind of extend on the first question you asked me. On what are we doing as a telco company in these fields? So the telco companies are converging to become ICT companies with time. That's because of conditions in the telco market, connectivity becoming obsolete and changing. Now communication is done through satellite and other means. And so what do we do now is that we shift into infrastructure, heavy infrastructure that is cloud-based offering, and also sectoral offering. So we have digital health, digital education, et cetera, et cetera. And so when it comes to digital health, we partner with the best of companies globally. Companies like some of them are the panelists today. Would be proud to work with you guys. So what we do with package what the best of the best are doing globally. We localize that experience, come up with a more fitting commercial model, and then try to push it in the market.
Yeah, and again, I think there's so many new things that are coming. Tom, stay with this a minute because there's so much happening. And, it's about, data, but it's also about this cooperation. Abdullah, Saad talking about working with other people here. But we need that collaboration. Policymakers, leaders, companies in healthcare, everybody has to be involved in this. But, how do you make that happen to get, I suppose, transformative power of this data?
I think it all starts with having a vision for what actually you're trying to solve for. So if you're thinking about this problem, it's so many possible variables. Let's just pick one. Let's just pick diagnosis.
Right.
If you think about the doctor's office of even 20 years ago, there was all this hardware in there for diagnosis, things to track your metrics or to measure something. Or today, everyone is carrying a supercomputer in their pocket. And if you can add capabilities to that supercomputer to help with diagnosis, all of a sudden you can actually be much more fair in terms of the distribution of healthcare. You can lower the cost. You can reach care deserts. These are the kinds of things that technology should be able to enable. In order to do that, you actually need to have, once you've got that vision, you actually have to have all the policy and all the mechanism to make that possible. You have to get the apps on people's phones. You have to have the ways to store all the records for all the people. You need to be able to have the AI and the science to say this is the diagnosis and it's correct. You need to have the care providers being able to say, oh, I can look at this record and I understand that this diagnosis is correct and I know what to do. It will require a fair amount of coordination and maybe even centralization from the perspective of a technology provider, perspective of government, from the clinical provider side, maybe even the insurer side. And I think to do that, you need a strong vision and a strong arm of coordination, especially when it comes to the privacy of the data.
Yeah, we're going to talk a little bit about that in just a minute, about the privacy. Abdullah, yesterday we were looking at some of the initiatives from the institute here, and particularly AI was very high up on the agenda there. And I think when we look at Vision 2030 in terms of what Saudi is doing as a country in every sector. So how do you leverage, I suppose, AI and machine learning to really analyze, I suppose, the large data sets and just get, the best insight that can actually, improve what we're doing?
Excellent. I think leveraging AI and machine learning can really open up a huge potential and opportunities for the healthcare sector to transform the services that they provide. One aspect around there, the predictive analytics, which today can really help hospitals, and in particular, for example, if we give an example, the ICUs, where we usually have a shortage of talents and where we have situations which is very critical that could data and AI technology could save life of human beings. So the power of analyzing continuously the vital signs, the lab results, and the historical data of the patients can really help the physicians and the caregivers within the ICUs to make sure that they are giving and intervene when appropriate and provide the immediate support and care to the patients who are requiring the most service by analyzing the declining human conditions or patient conditions within the ICUs. The same algorithm as well can be used to aid and support the physicians in terms of the discharge decisions within the ICUs by analyzing the risk associated with such type of decisions. This is around the treatment, around the diagnostics, let's say, part of the healthcare organizations, but as well as AI and data technologies can help to improve the operational activities within the hospital to be more efficient in terms of providing the vast service and analyzing the document faster. Moreover, as well, increasing the accuracy of the services that they can provide to the patients and beneficiaries. These are examples of such use cases where AI can help within the healthcare organizations, but there are more use cases that can be enabled and backed by the AI.
Yeah. Nita, tell us a little bit more about that specific project that you're working on, environmental wastewater and the testing you're doing there, and how do you gather that data and how are you analyzing it? What are you learning from it?
Yeah, so the data is coming right now from aircraft wastewater testing. So we're actually testing airplanes that are coming in to countries. And so we're working, for example, our project with the U.S. Centers for Disease Control, testing international flights coming in to the U.S. And we're also working with 10 other countries. And through this program have tested aircraft wastewater and done passenger swabbing for originations from over 156 countries around the world. And so what we do is we have developed a collection device that attaches to the airplane, and then all of the wastewater comes out into a testing and sampling platform, which we then test looking specifically for viruses, starting with SARS coronavirus, but the cause of COVID, but also now we've expanded it to other types of pathogens as well. So this is an expanding program, and through this effort, we have found that we can detect these new COVID variants, for example, weeks in advance before they show up in a clinical setting. And why stop at airplanes? Because wastewater is everywhere, and this is something that we're actually about to launch in a few other types of locations, including in settings that have to do with like livestock production, in healthcare settings. And so these are areas where we can detect what's circulating and get an early indicators. And then maybe just to add to that, I think the key really here is this continuous monitoring, because in order to apply the AI tools that we talked about, you really need to have a continuous data stream, need to be able to apply, establish what is the baseline, and then be able to identify what are those anomalies and what really is coming out as something to be concerned about.
Tom, talk to us. Are you all familiar with the Aura ring? Look at Tom's rings here. He's got them all on. Yeah. Oh, we have a few in the audience. The cult of Aura, huh?
Yeah.
And you'll all be connecting soon. But again, talk to me about some of that, data you're collecting. And Nita, they're talking about getting information in advance, the way they can make decisions. I mean, can you gather that type of information from the Aura?
Yes, I mean the things that Aura collects. Your respiration, your temperature, your heart rate variability, a bunch of other metrics. Collecting them continuously is actually key, because you actually see changes in the data, and that triggers an AI or an ML model to understand that something's changed. That is the key. So if you think about what AI and ML can do once it has continuous data, is actually it can be personalized to you. For example, it might tell you that you're starting to get sick and maybe you should change your behavior. You should stop exposing yourself to other people. During COVID, Aura kind of came to the front because we had a study with 65,000 Aura ring wearers, and we were able to see in their biometrics 3 days before a diagnosis of COVID that they were starting to get sick. This was before symptoms were showing. Their heart rate was slightly elevated, their HRV had started to drop, their respiration climbed. They didn't have symptoms, but they were starting to show in their physiology. So think about the power of that kind of monitoring system where you start to see, maybe even geographically located a set of people who are getting ill, and you can take an intervention. The key about your airline wastewater testing is that it's linked to something that's really important, which is identity, because you know who's on that plane.
Yes.
You can actually start to track and see who it is that might be the vector for the disease that you found.
Well, just so that we're not tracking those particular passengers, but we do know where the country of the origin
the country
is
of origin,
flight.
yes. And that's hugely important.
Yeah.
Saad, I mean, picking up on that too, that data collection, and again, some sectors doing it better than others, but ultimately, data collection, analysis, value, use, all of that, it has to be win-win, and it has to be secure. I mean, there's a whole lot of data going on out there, and probably way too much data out there about me at the minute, or anybody else, or you. How do we know it's safe?
We hope. I'm just kidding, but I think it's a combination of proper policy that has to be there, and then the few things that Tom mentioned initially. There's a lot of collaboration that has happened, but there is an umbrella of policy, just so the constituents, the owners of the data, are comfortable sharing their data and also comfortable using the diagnosis that is given to them eventually. I think there is that. There is a properly secured and maintained infrastructure, whether it's your cloud, whether it's your cybersecurity measurements, or your processes within your organization. And I think just to build up on what was said by Tom specifically and Abdullah, data is something that we have, and we've been hearing for a few years that data is the new oil and stuff like that. And I think
And that's especially true in Saudi Arabia, huh?
well,
in any other country, you wonder why they.
Ironically, I think data sits in a lot of places, but it's not properly used, or value is not extracted from it. And I think that's the conundrum there. I think it's the right tool of the right skills, the right technologies, and the right vision, as Tom rightfully mentioned in the beginning. So you know what you're aiming for. And I think with that, nothing is impossible. I think we're positioned at the forefront of a transformation like that. We are still in early stages of AI, of healthcare diagnosis. There are still efforts, but we're at the cusp of the start of this transformation, in my opinion.
Now, if anybody wants to ask a question or anything here, here's Vincent. He's here. He's ready with his microphone. And, well, we did have Christian, but we have a new friend. How are you doing? Okay, so either of them, just keep an eye on them if you want to ask a question here, because we'd like to get you involved. But Abdullah, carry on this conversation too, in terms of sharing data. We have many stakeholders across different industries at the moment. And, how do we make sure, I suppose, following on, that the right people are getting the right data and that, again, it's safe?
Well, I think what organizations are starting to do when it comes to making sure that the data that they share is secure, as well as they are open in terms of their own system to be integratable with other healthcare systems within the organizations or across the organizations, that they need, number one, to modernize their own data infrastructure to allow such kind of integrations to happen. A lot of legacy systems are still there. It has been invested since long time within the hospitals, but there are other ways of how we can complement and augment what have been already invested, and make sure that you as well leverage, and you can leverage the other data sources that you can integrate within the healthcare organizations in order to unlock the power of AI. But always when it comes to the cybersecurity, it's a kind of balance, how you strike the balance between being open to achieve your objective from taking the full potential of data, as well as how you can make sure you have strong security practices within the organizations that trust no one and verify everything around user data and services. So it's a kind of balance that will help organizations within the healthcare sector to embrace innovations. Another aspect is around the collaborations, because data and AI projects needs to be worked as a collaborative effort between the frontliners and the data and the technology specialists. So the early adoptions and the early involvement of the frontliner in the data and the AI projects is very crucial for the successful or the success of as a success factors for such type of projects. Because at the end of the day, the frontliner are the people who are going to use this data when dealing with their own patient at the front line. This is when it comes to data and AI for the frontliner, but there are as well other challenges that can be resolved when it comes to putting the right investment and the right fund and the right priority for such type of projects from the top of the organizations within the healthcare sector. This is very crucial to look at it from that perspective, that data and AI projects touch directly the patient and touch directly the outcomes that we provide to them. So these are the top of the challenges, but I think with everyone's support within the whole healthcare ecosystems, we will be able to overcome.
And everyone's concerned. I'll get your opinion on this in a minute, but I want to come. We have a question from a gentleman in the audience. Sir, please let us know who you are.
Hello, thank you very much. Andreas Kangilaris. I'm the founding president of Neo University. The question I have is very simple. We make the analogy between data and oil. And we know that the producers of oil are benefiting from producing oil. When it comes to data, the individual is a producer of data. What are the benefits to the individual, or how do we incentivize the individual to be a partaker in the future revolution of healthcare through data?
Okay. Who wants to take that now? I can't have everyone take it because we need to move on and keep. Who's going to take that one? How do we incentivize the?
Yeah. I got a simple answer, which is that if you want to improve your health, providing data to a system that's going to help you improve your health is an incentive in and of itself.
Yeah, but Tom, that doesn't really work. I should be out running this morning, and it would have improved my health, and somebody's told me that, and I didn't do it. Sorry.
Yeah.
But, I mean, I know exactly what you're saying, but how do you get people to that level whereby they want to do it?
So obviously that's the hardest problem in all of healthcare is changing behavior in a preventative way. I think you have to lower the barrier. You have to make it easy. You have to provide the value quickly and immediately, and it can't just be in the case where there's some infection that you're avoiding. It has to be a positive feedback loop. And I think you have to actually give the information in a way that is consumable and understandable. I'll use Aura for a second, which is sleep is key. Sleep is key. You sleep every day. You eat every day. And if you can see the impacts of daily behaviors in your health, that's a strong incentive. And the thing is that if you get that incentive right and that flywheel is turning, then the data can flow to all these other places. It can be used for monitoring of illness. It can be used for anonymized prediction. It can be used for personalized medicine. All these things are incentives that are driven by the fact that it's a daily behavior.
Yes. So it is about shifting that.
Yeah, I would like maybe to add to what Tom mentioned is that definitely this is all related to the incentive, but the foundation of this, building the trust with the patients on how you're going to use their data, how you're going to maintain it, how you're going to secure it, and getting the consent that you are going to use this data for the benefit of them. These are the foundation on top of the incentive that was mentioned by Tom, but I think it's all come together in order to incentivize patients to share their own data and get the best outcomes from sharing such type of data.
So we're not getting any frequent flyer miles or anything. We have the professor here, and I'll come to you in a minute. Gentlemen, but Professor, please tell us who you are.
Thank you very much. My name is Joanne Whelan. I'm a professor at McGill University in Montreal, Canada. And I just wanted to pick up on one of the points that came up earlier, dealing with emergent threats such as infections and so on. We're dealing with systems that are biological and they're evolving. So I'd really like to know how the AIs and the other models are being used to sort of forecast these future threats of an evolving system. I know it's really tough, but I'd just like to get a sense.
But Nita, you're looking at future threats, if anybody is.
Yeah, so that is a great question because I think this is something on the forefront of where science is right now. Because what we're doing by gathering these genomic sequences of these pathogens is it allows us to be able to predict how it will evolve and whether or not vaccines and antiviral medications will continue to be effective. And so I think what we're now trying to do as we're amassing more and more of these sequence data is to apply these AI tools. And really what we're trying to do at Ginkgo is trying to apply large language models in a way that will allow them to speak DNA and RNA to really be able to predict what those future viruses will look like.
Thank you for that. We have a few more questions, which is great, please. And again, if you can direct your question maybe to one person, because I'd love everyone to do it, but it's a time constraint. So think about it, and let's see who you want to talk to.
Good morning. So my question will be for you.
Tom.
Thank you very much. So I am Natalia. I'm from King Abdullah University of Science and Technology, and I'm a PhD candidate there. And my question is related to what you guys were discussing about the prevention strategy point of view. And because for us, I think it's very important to change habits, especially when it comes to what we eat, because that determines a lot of the different diseases that we could potentially develop.
So true.
So I would like to know what would be any strategy to communicate to people in general how they can change these habits and how they can benefit from that, and maybe how can you collect this information of how people are changing actually these habits.
Is that Tom?
So in order to change a habit or create a habit, you need three things. You need education and information. Person needs to understand what they're trying to accomplish and why they would want to do it. The second thing is that you need time. Changing or making a habit, generally 6 to 8 weeks of steady activity before it starts to really look like a habit. And the third thing is you actually need data. The data is what actually cements the habit. So for example, if you're talking about metabolic health and you're trying to kind of get someone to eat healthier, if you make it very simple, take your smartphone, snap a photo of what you're eating. It immediately tells you the glycemic index of what you're eating and then predicts what's going to happen to your body thereafter. That's a beginning. That's the data side of it. The behavior part of it, you have to keep them doing that for a long enough period of time with enough insight that they're like, oh, I shouldn't be eating so much sugar because it's ruining my blood sugar and my insulin response. And then the last thing, of course, is you need to be able to make that understandable and comprehensible. It can't be presented in high-end scientific language. It has to be like, your blood sugar could cause type 2 diabetes, and here are the symptoms you might have. That's how you get a habit to happen.
You're so true, communicating that message. Ma'am, you have a question for us. And again, let me know who you want to answer the question.
Can you hear me?
We
Hi.
got here Saad, Abdullah, Tom, or Nida. I can only give you one
Saad,
of them.
please.
Saad, good.
My name is Saleha Osmani. I'm from Falcon Bridge. I had a very simple, basic, and by the way, loyal customer here. Insurance companies, how do we protect ourselves as an average consumer from insurance companies? Because when all this data is available, it can be used against us without us knowing, because we don't even know our pre-existing conditions, but this data can give you like an analysis or a prediction.
Wow, we'll have the virtual ambulance chasers, huh?
Yes. Thank you for the question. I think it's such a valuable question, and an angle we haven't explored. I think, as I said, I think insurance data is one of those companies that sit on a large pool of data. Some of them are starting to generate insights and value from it, at least here in Saudi. And the difference, maybe reflecting on maybe the question raised earlier by Andreas, what is the value to me as a person? I think we're still trying to protect and conserve the patient data before we start using it, at least here in the Patient Policy or Personal Data Protection Act. we're being overly protective and extra conservative in how we want to avail private sector or data manipulation. With time, I think that should be eased, and maybe as we move into Web 3.0, where actually individuals, a population can actually generate monetary value out of commercializing their data on blockchain or other maybe models of operation. But today, and I think staying on the conservative side, we know that they have it. We don't know, you said, to protect us from them, right? And so we don't know to what extent can and are they being used honestly today. The data protection law should prevent them from abusing that today. And I think globally that should be the case. Companies will always be incentivized to extract more value from the asset that they have today. And so they will be driven towards that unless there is a certain maybe protection laws to prevent that.
Now, we've less than 10 minutes left. Tom, the World Health Organization estimates that in 2035, we're going to have a shortage in healthcare professionals by about 13 million. Now, I think Abdullah mentioned that AI can help there. And you might have spotted Desdemona in her purple hair behind there. She was singing earlier. I think Vincent shut her up for us for this session. But she has a cousin running around, Grace. And Grace seemingly has been already visiting various hospitals and doing something, God bless her. Or it. I don't know what we call that
what's their pronoun?
Machine. Yeah, what's their pronoun? We don't know. But again, how can AI actually really help? Because if this shortage, is looming and the demand for healthcare, eventually we'll all pay attention and we'll all take more control.
I think there's a spectrum of things that AI can do. On one end of the spectrum, it's probably education. If you think about the experience that people are having with ChatGPT, where they're interacting with something that feels like, a human doctor, maybe even. You look at what
you ask nicely.
Yeah, you still get a very good bedside manner, and the capability here is amazing. It's well known. MedPalm, which is the Google kind of large language model, actually passed the medical boards in the United States and probably did better than many medical students actually do after years of training. That's one side of it, which is this kind of education interaction, helping people understand, like, what condition do I have? How can I avoid it? What can I do? That's one end of the spectrum. The other end of the spectrum is literally an AI doctor. And an AI doctor that's running on a smartphone, that's informed with your information, has all of your electronic health records, has your up-to-date biometrics. That is actually not just possible. I'd say it's probable. I think people are on a trajectory to see AI doctor, be a thing. Now, it has to be regulated. You have to do no harm. There's lots of regulatory kind of hurdles to get over there. But if you think about that spectrum, think about the impact of that on care deserts. 13 million, if that's the shortage, that means actually that there are millions of people around the planet who will just get no care at all. But they probably have a smartphone. And can we deliver some kind of care? And is that care better than a doctor? Well, maybe not. Yeah. Is it better than no care? Absolutely.
Abdullah, please quickly come in on that, and then we're going to have to wrap it up on this very issue here, the talent shortage.
Exactly. I think the talent shortage is coming across different aspects. Number one, within the healthcare organization and the healthcare professional themselves, as well as the data scientists and the AI scientists who are enabling and deploying and provisioning such type of services for healthcare organizations to be much more efficient and provide remote medicine or addressing the shortage of the talent within the hospitals. So definitely AI could help in automating a lot of the tasks. ChatGPT and generative AI is one example, which is mentioned by Tom. Yeah. Another example of how we can monitor the efficiency of the service delivery within the hospital itself. How can we act very fast through video analytics, through data analytics, by providing the healthcare services as fast as possible and as efficient as possible within the hospital. Data and AI can help in making hospital doing more with less in terms of resources.
There is, I think there's so much, and the lovely thing is it's changing all the time. I've got about 30 seconds each for you just to wrap this up. Nida, let me just start with you in terms of, looking ahead, what do you think is possible out there? What's transformational? Is there a call to action you want? What can we do?
There's so much that we can do to get better at preparing for and responding to epidemic threats. And so I think what we would like to see is a greater integration of all this data from many different sources to be able to triangulate like what is happening and to find out as early as we can. And this really is a matter of national security. Like the safeguarding health is a matter of national security and something that really should be taken seriously and have continuous investment.
We really do. Tom, again, what's possible?
Prevention and really, at the end of the day, precision. We're living in a world with all the data known about you from cradle to grave. The precision that's enabled there should lift the quality of healthcare.
Abdullah, again, just wrapping it up here, anything, what do you think is really possible here, transformative? What do we need to be doing now?
I think the personalized care services that we offer to the patients, which again, it's relying on the continuous monitoring and the real-time data that we monitor and collect about patients' behavior and patients' conditions. Yeah. And personalized care is the key word for the future of healthcare.
And Saad, a closing word from you. Inspire us as we go off and live a healthier day.
I'll try.
Online.
I'll try. And so I think the slogan of this version of FII is the new compass. And I think together as a community, we have to keep doing what we've been doing, do it better, do it more collaboratively, whether with operators and private sector players and with policymakers to make sure that we leap forward in the right direction.
So there's lots to play for, but it's a fascinating industry, I think, at the moment. And I think the lovely thing about it is that we can actually control a lot of this. I really want to thank all of you and read about them and the great work that every one of them is doing. Nita, keep up all the great work you're doing. Tom, keep that ring shining there and feeding that information. And Saad and Abdullah keep us all online and keep us focused. Thank you so much. So a big round of applause for my dear panel here. Thank you all for taking the time. And don't go away. We have a great session coming up in just a minute. And again, thanks to our great Vincent and our colleague here, keeping the questions coming in. The Gates Foundation is going to come here, and James Carty is going to join us to moderate the next session. Really looking at global health and looking at some of the setbacks there have been and what we can do about it. So please, sit comfortable. Come up near the front here. We have first-class free upgrades going today. So come up and get relaxed and listen to this. Thank you all.